This is Srikumar, Professor of Pathology from MAHSA University in Malaysia, here with you once again to continue with where we left off last week. Now, in today's session, we're actually going to talk about effects of inflammation, the sequelae or outcome of inflammation, and chemical mediators that control inflammation. But before we move on, let's actually see what we did last week. Last week, we actually saw that there was a battle between the soldiers and the terrorists. And this was an analogy I gave to help you understand the battle between the WBCs and the bacteria. So in this session, I'm going to continue and we can actually see who wins, the soldiers or the terrorists. So who wins in the body? Is it the bacteria or the WBCs? If the WBCs win, what happens? If the bacteria wins, what happens? So, but before we continue with this story, let's have a quick recap of what we did in the previous session. We actually saw that acute inflammation involves changes in the vascular flow and caliber. That is, the blood vessel undergoes vasodilation. And there are many holes that open out in the blood vessel. So that is called vascular leakage. Then the WBCs inside the blood vessel roll over. They move towards the side. This is called margination. They stick on the sides. This is called adhesion, transmigration. And they move through the blood vessel outside towards a stimulus. This is called a chemotactic stimulus. And they eat up the bacteria. This is called phagocytosis. So if you remember, I actually connected this to a nice analogy where soldiers go after the terrorists and the soldiers arrive in a plane, which is the blood vessel, and the soldiers are the WBCs. And from the plane, they jump out, which is increased vascular permeability. The plane is wide, which is vasodilation. And then as the soldiers come out to the side, they marginate, they roll, they adhere to the wall of the plane and jump out of the plane. That is the WBC coming out of the endothelial cells. And then they move towards a chemotactic stimulus, which is the terrorist is giving a stimulus which the soldier sees with a sensor, beep, 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 beep sensor, and he goes and connects to the terrorist and takes him inside him and destroys him. This is phagocytosis. This should help you understand what we saw last time. Margination of the WBCs. The WBCs roll over, adhere, diaperesis, chemotaxis, and finally phagocytosis. And we also saw 5 cardinal signs of inflammation. Now this picture should help you understand how the 5 cardinal signs of inflammation can be remembered in the mind. Heat. I mean, all these guys are holding up this big pillar called inflammation. The first one is being burnt by the second one, heat. The second one is naked, so he's blushing, redness. The third person is fat, that's swelling. The fourth person just had something dropped on his toe, pain. And the fifth person has a fracture, so the building is crumbling, loss of function. This picture would actually help you to easily understand the 5 cardinal signs of inflammation. And the 5 cardinal signs of inflammation is remembered in Latin as cala, rubor, dolor, tumor, and functio laesa, which is quite important for you in all specialties, whether it be medicine or surgery or obs and gyn or pediatrics or orthopedics. You see the same 5 cardinal signs in every disease.